Hi there, my name is Claire, and this video is on behalf of Nita, Kanani, Kelsey, and Jamie, and we are so excited to share a little bit with you about our project on neurodevelopmental disorders. A quick definition: they are an umbrella category of a group of conditions that typically occur during a developmental period before the child enters grade school. There are different types: intellectual disabilities, communication, autism spectrum disorder, specific learning disorder, or even motor disorders. We're going to mainly be focusing on ADHD today. Neurodevelopmental disorders in school are typically difficulties that affect educational and psychosocial outcomes. They are complex needs that require support from professionals in the school setting. What is ADHD? It is the third most common disorder following depression and anxiety. It is characterized by consistent patterns of inattention or hyperactivity. Some symptoms can include difficulty sustaining focus and excessive fidgeting. 6 or more symptoms of inattention or hyperactivity must be present for at least 6 months and negatively impact a person's social, academic, or occupational duties in order to be diagnosed. There are 3 types of ADHD. The first is predominantly inattentive. The second is predominantly hyperactive, impulsive, and the third is combined. How do we treat ADHD? It can be treated with medicine, behavioral treatments, or accommodations within the school setting. And what is actually really encouraging is that 62% of children are receiving medication and 47% have been receiving behavioral support. So as a whole, 90% of children with ADHD are receiving accommodations of some sort, such as daily report cards, using clear commands. We looked at a few areas of support for children with ADHD. In the school setting, one thing we did was come up with an acronym for OTMP, Only Turtles Make Pancakes. OTMP stands for Organization, Time Management, Management of Materials, and Planning. And organizational skills training focuses on those 4 areas. It helps provide more intense and specialized sessions to support students to gain skills. Other support that we looked at was behavioral classroom management. And so this one, if you think about a multi-tiered system of support, so if we think about that triangle with 3 tiers of intervention, at the tier 1 level, all students can receive support on the behavioral classroom management systems, such as using clear commands and using positive praise so that behaviors are encouraged while negative ones are discouraged. That's kind of an easy universal one. At the tier 2 level, students who would benefit from more targeted support can begin doing things like receiving a daily report card, have some responsibility with their parents and their guardians, and that can help with more specific behaviors. They can even do a token or reward system. And then at the tier 3 level, students can receive even more intensive support by receiving a functional behavior assessment and developing a behavior intervention plan. To wrap things up, we have a QR code at the bottom there for more additional resources. And again, there are more neurodevelopmental disorders. This is just a comprehensive overview of ADHD for you. Thanks so much.